Hello all, welcome, good afternoon. My name is Kevin Shaffer. I am a Senior Research Support Specialist at the Center for Clean Water Technology. We've just saw quite a bit about PFAS removal and remediation. I want to go beyond treatment and talk about how we monitor and look at PFAS and other contaminants in the environment. PFAS contaminants in the environment. Pardon. So there are a lot of ways that we can be exposed to PFAS. And one of the primary routes is through ingestion. We've talked a lot today about drinking water. We see others here, things that we ingest, food, vegetables, fruit, meats, fish, the packages that our food come in, the boxes that our food come in, all of these things can contain PFAS. That's why monitoring is so important. And when we monitor, some of the things that we look at, groundwater, surface water, both critical here on Long Island, also soils and sediments, which can act as PFAS reservoirs, and also organisms, anything from clams to crabs to fish, anything that we might consume, actually. There are thousands of different types of PFAS, but generally when we do analysis, there are only a few dozen that we're looking for. And those include legacy PFAS like PFOS and PFOA, other persistent PFAS like PFHXS and PFNA, and what we would call maybe emerging PFAS like Gen X, which is also known as HFPODA. So some time ago when we realized that many of the legacy and persistent PFAS were toxic and harmful to us, we started to phase them out, and we created these emerging compounds and replacement compounds like Gen X. But what we are realizing now is they can be equally as toxic and problematic as their predecessors. So when we analyze a sample, let's say a fish, typically what we would do is look for the PFAS concentrations in specific organs or in tissues or muscles or the fillet, something that we might consume. But recently we took an entirely different approach at looking at PFAS exposure in fish, the scales. And what we looked at were over 30 years of archived scales. And this allowed us to create or see a long-term exposure history of PFAS in striped bass from the Hudson River. And this allowed, and because the scales are metabolically inert, basically when the PFAS gets trapped in there, it doesn't really leave. And so we were able to see things, long-term exposure, that are not possible with conventional analysis methods. Things like we see more short-chain compounds, we see more emerging contaminants, emerging compound, PFAS. And some of the trends that we saw here in this multi-decadal study, we have an increase in persistent PFAS, like PFNA, and also you can see in blue here an increase in a short-chain PFAS like PFHXA, where from 2000 to 2010, you can see that steep increase over time. Also, an increase in emerging PFAS, like Gen X, down at the bottom of this figure. Since 2000, around the time of phase-out and where this came into use, we see it increasing over time in the red there. And what of our legacy PFAS, like PFOA and PFOS? Well, there isn't really a significant increase or decrease, but a constant presence in the environment, and which suggests that they're not really leaving in a lot of systems. We also have the opportunity to look at produce from both organic and conventional farms here on Long Island. And what we see here in this figure, we looked at both moving from left to right. we looked at carrots, lettuce, and beets. And within those three vegetables, we have 4 different compounds: PFOA, PFHXS, PFOS, and Gen X. And we can see pretty quickly that the concentrations in PFOS and Gen X in carrots were considerably higher than the other 2 vegetables. But overall, there were 4 compounds, the 4 compounds in carrots, and 3 in each of lettuce and beets were all found to be above the EPA daily dose, reference dose, excuse me. It's important to note that this is not a unique problem to Long Island. It is not a unique problem to this country. It is a worldwide problem. So we've just looked a little bit at how we monitor for PFAS and the importance of PFAS and other contaminants, and how we detect them in our environment, in our food, and also in and elsewhere. I want to expand upon this idea of monitoring to help improve public health with wastewater as a community sensor. In wastewater, we can learn things about disease outbreaks, contaminant exposure, and also substance use. At the Center for Clean Water Technology, Dr. Rahul Kumar leads this research. When we talk about wastewater epidemiology, this is the look at the biological and the chemical markers within wastewater that can tell us what's going on and help us better understand what's happening in a community. This is a community. And everything that they consume or that they are exposed to inevitably goes into sewers, into septic tanks, and ultimately, hopefully, to a wastewater treatment center. From there, we would collect a sample, process it, and analyze it. And from that data, we can learn about drug and alcohol use. We can learn, again, about disease outbreaks and also contaminant exposure. And this allows us to track these trends over time and use this information to make better public health decisions. And all of this occurs while protecting the individual privacy of people. We have 2 figures here of drug overdose deaths over the last 10 years in both the United States and here in New York State. In the summer of 2023, in 1 month, at the height of opioid deaths, there were over 160,000 lives lost in the United States alone. And during a similar period in New York, over 4,000. We can also see here that cocaine is one of the leading causes of overdose death in the United States, and even more so here in New York. But most recently, in coming years, we see all these numbers coming down, which is fantastic and great news. And we see that gap between cocaine and opioid-related deaths is narrowing. The Center for Clean Water Technology can help local counties track these trends to help this ongoing epidemic. In these 2 figures, we have some consumption data, estimated consumption data from wastewater. And we have a number of substances, drugs here that we found, but in both Nassau and Suffolk counties. But you can see right away here that cocaine is by far and away the most commonly detected of any of these substances. We can also look at cannabis in wastewater. And I should say that here in New York State, that it is prohibited from selling cannabinoid products that contain artificial or synthetic versions of cannabinoids, and this includes delta-10 THC. And that's just again, the synthetic form of cannabinoid. The natural form, on the other hand, which is plant-derived, is delta-9 THC, and so these have different signals within wastewater. Here in this, this study of 5 different study sites in Madison County, A through E here, we found both natural natural THC and also synthetic THC. And I believe this is the first time that we're detecting the synthetic form of THC in wastewater. But the other thing to see that it is interesting is, of the 5 sites that we looked at, site D there, circled in red, we can see that those are the lowest occurrence, or the lowest concentration that we saw, right? That is the one federally regulated site out of all 5. So overall, this community-based data can give us really valuable insights into substance use trends over time that can help us better inform and improve public health decisions. I'd just like to acknowledge our help and support from the DOH, also the Nassau County Department of Health, everyone at the Center for Clean Water Technology, and many other brilliant folks from SOMAS and elsewhere that put a lot of effort into this work that you see here today. Thank you.